degree focused on global health leadership. Patrick's work, both as an MPH student and prior to joining NYU, exemplifies the social justice perspective inherent in so much of what public health is about. He has worked in settings as diverse as Botswana, Malawi, Montreal, Nepal, among other places, developing informational, educational, and communication tools to address drug abuse prevention, sexual reproductive health, and mental illness. He is a tireless advocate for those who are marginalized and is committed to fighting for health equity and well-being among the world's neediest populations. Patrick's many accomplishments and ambitions reflect the qualities and character of our graduating class tonight. Patrick also happens to be fluent in Chichewa, the national language of Malawi, although I will ask him to please deliver this evening's remarks in his native tongue of English. I am now pleased to turn the podium over to Patrick Pageant.
Thank you, Dean. And I want to first start with thanking all of the staff and administration at the Global Institute of Public Health. It's been great today to put faces to all the emails that I've gotten over the years. I'd also like to thank all the faculty that's here with us, that's inspired us, that's motivated us, and that's taught us, and that's also put up with us for the last couple of years. Thank you. To all the friends and family that have supported us and loved us and listened to us vent, thank you. Thank you. And of course, I don't think I'd be here today without the rest of the students. My friends, I'm honored to graduate with you and to call you my colleagues. Thank you and congratulations. I spent a lot of time trying to figure out what I was going to say today. I did some pretty thorough, in-depth research, which mostly consisted of Googling how to write a graduation speech and watching videos on YouTube. So I feel fairly confident that this will be the best student speech that you're going to hear today. When I was first asked to speak, I was asked to submit a theme. And I thought about what our role is as public health professionals, and this class in particular. And the idea of voice immediately came to mind. And I don't mean the TV show or the sounds that come out of our mouth. I mean the tool that we use to express ourselves and to communicate with each other. Because I know that this class has a voice, and I know that we are not shy about using that voice. Whether it's to complain about unfair classes or grades, or the scheduling of every single public health class at 4:55 p.m., there are other times. We've not been shy about being vocal and outspoken about what it is we want and where we see room for improvement. And the Global Institute of Public Health has given us the space to be vocal and to make the improvements for the generations to come. But we know that it's not enough. Our voices are not just for complaining, even though it's a really fun thing to do. You know, I'm pretty sure that I was born with my voice. I think I came out and I started speaking. I've yet to stop. But I was lucky. I was born in a family. It's amazing. And they inspired me, and they motivated me, and they encouraged me, and they empowered me to speak out and to speak up for what I felt that I deserved. But there are millions of people in this world who are not so lucky, who don't come from the same conditions, who are not given the opportunity to speak. People who suffer in silence, people who deal with oppression and illness and disease and fear, people that go unheard and ignored, people that suffer and die preventable deaths because nobody will give them the chance to speak. As a graduating class of public health professionals, it is our job to use those voices that we've found to speak with these people, to speak with these communities that suffer. You know, many people view health as a personal responsibility, that each individual is responsible for their own health and the outcomes that come from it. But we as public health professionals, we know that there are structural inequalities that exist in this world that there are social determinants that impact our health, things like stigma and discrimination and poverty. As a social worker, I was taught to empower individuals, to overcome the challenges that they face. But as public health professionals, we were taught to empower communities to take control of their lives and of their health. And it is our responsibility to work with them, to find these communities that are at risk and that are in need, to find their voices and to make them be heard, so that we can fight together against the systems that invalidate them and dismiss them. The systems which create and sustain inequalities and lead to disparities in health and in wealth and in well-being. But to do this, raising our voices is not enough. The other part of communicating is listening. It's this other skill they taught me as a social worker, the one that took me a little longer to understand. We're here as public health professionals, not to speak for people, but to speak with them, to help them to find their voices and to give them the platform and the power to speak for themselves, to enable them to speak up and to speak out, and to demand what is rightfully theirs. During this program, I had the opportunity to go to Nepal and to Botswana. It's really an amazing experience to be able to travel and to work in and with another culture. It allows you to reflect on your own experiences and your own history, and really opens you to new ways of thinking and to being. When you're in a different culture, it's really easy to spot the differences. But when you look closely, you can start to identify the similarities, and you can see that there are aspects of humanity that are universal, that allow us to communicate across cultures and across languages and across the entire country and across the entire world. That's what's been so beautiful about this program. We are a class of global health professionals coming from all over the country and all over the world. NYU has brought us together to share our stories, to hear each other's voices, and to listen to each other, so that we can find a common language that we can use to break down these structural and cultural barriers. And instead of fighting as independent nations for our rights and our freedoms and our health, to come together instead as a global community that understands when one of us hurts, all of us hurt. To understand that our liberation, our health, and our well-being is bound together. And that it's only in coming together and raising our voices in partnership that we can create the world that we want to live in. So I'm going to leave you with a few words from some of my favorite modern poets. I'm talking about a revolution. It sounds like a whisper, but voices carry. Let's work together to improve our way of life. Join voices in protest to social injustice, a generation full of courage. People of the world unite. Strength in numbers can get it right. We are a part of the Rhythm Nation.